Very good morning to all of you. I am Dr. Hamid Ashraf, currently working as Associate Professor at Rajiv Gandhi Center for Diabetes and Endocrinology in Aligarh Muslim University, Aligarh. Today I am going to discuss about dietary habits during Ramzan. We know that during fasting, when no food or drink is consumed, body uses its store of carbohydrate and fat to provide energy. Body cannot store water, so the kidneys conserve as much water as it can by reducing the amount of urine passed. Depending upon the weather and the duration of fast, most patients will experience mild dehydration during fasting hours, and this can lead to headache and weakness, tiredness, difficulty in concentrating. However, multiple studies have shown that this mild dehydration is not harmful for the body provided enough fluid is consumed between the iftar and suhoor. Those who consume caffeine during non-Ramzan may also get headache due to lack of caffeine during Ramzan fasting, but this usually subsides with time. Regarding the dietary practice during Ramzan, it is important to note that it is benefits of Ramzan fasting can only be availed by people with diabetes who can maintain an appropriate diet. It is suggested that diet during Ramzan should not differ from the general dietary guidelines for this group of people which are followed throughout the year. And this include both kind of patients, those who are treated with oral antidiabetic drugs or those who are treated with insulin. And diet should usually be a healthy balanced diet and distribution of calories into 2-3 smaller meals during non-fasting hours, and this will help to prevent excessive rise in post-meal blood glucose. Pre-dawn meal ideally should be taken as late as possible and should consist mainly of complex carbohydrate to prevent acute rise in blood glucose and to prevent a rapid stomach emptying. Complex carbohydrate includes the vegetables, the whole grain cereals, and lentils and fruits. High calorie foods, which is rich in refined carbohydrate and fat, like samosa, jalebi, pakoda, paratha, and this feni. And these are the traditional dishes which is consumed in large amount during Ramzan. But this kind of food should be avoided by the diabetics because that can lead to hyperglycemia and problem to the patient. Eating dates traditionally mark the end of fast, but they are very rich in carbohydrates. So dates can be consumed, but it should be in moderation. Maximum 1 or 2 dates can be consumed at the iftar by the patient, because consuming this much of dates will not lead to that much increase in blood glucose. And it is also advisable to have evening meal or dinner as early as possible at iftar, and this should comprise whole wheat flour chapatis, vegetables, and meat or fish as liked by the patient. Salads should also be taken to increase the fiber intake. A late night snack with glass of milk or a portion of fruit can also be taken at bedtime, and it is suggested that non-calorie fluid intake should be increased during non-fasting hours. And different kind of those beverages, sharbats, which is very commonly used during Ramzan hours, especially in summers, especially if they are sweetened, they should not be used by the patient. If they want, they can use different kind of non-sugary beverages, and non-calorie beverages should be used by the patient to maintain good hydration during Ramzan. And ideally, caffeine-based drinks such as tea, coffee, and cola should be avoided, because caffeine is a diuretic which stimulates water loss through urination. That's all. Thank you very much for your patient listening.